By the end of this video, you're going to learn how to diagnose, prevent, and treat ulcers in horses. Now, ulcers can lead to a variety of life-threatening conditions, including colic, so it's really important to learn about them. My name is Pet Doc Donna, and I've been a holistic vet for over 30 years, so let's help get your horse feeling better. Now, I'll warn you, if you skip any of these 3 steps, it could lead to your horse being uncomfortable longer than you'd like. So let's not skip any of them. First, we're going to check our ulcer points. And I'm just going to use a light touch, barely even touching the skin. And I'll show you the points that I usually like to check. So, oh, good boy, wait. So I check a point right behind the withers, right here, right behind the withers, going all the way down to the girth, and we'll just check the whole girth line. Then I'll check the whole midline, and then I'll check bladder 20 and bladder 21. Is there any pain? So how can you tell pain? You can tell pain if the ears change, if the horse leans back and looks at you. So right now, Mick is not showing any signs of ulcers, and he's been out most of the winter. Let's check the ulcer points. We go behind the withers. Remember, we go behind the withers? Oh. No, I don't think so. Then we come down into the girth area. And if they have ulcers, these points usually jump at you. Also, a lot of horses with ulcers, you can see their ribs. They look like they're sucked up. And then we'll come in and we'll try to do governor. Okay, so this right here, I don't think he likes that. What do you think, Kim?
No, when he starts biting.
Yeah. So, okay, so this is a point called CB14, CB16. So I have to look those up, to be honest, to see what that means. But any point along the conception vessel could be ulcers. And then we'll just check, we'll just check bladder 20, bladder 21. And we found that point from the other side. I don't actually see it. So we found a few points, but they're probably more related to other conditions he may have. Hey guys, I am with Rockstar. Isn't he cool? What a cool name for a horse. And we're just going to check him for a couple of ulcer points and see if there's any issues, because lately he's had some problems. He's become girthy. And there's a lot of reasons why horses could become girthy. One is ulcers for sure. Others could be that their sternum could be off chiropractically. They could have trouble with the saddle fit. They could just have problems. They don't want you to put a saddle on because they don't want to be ridden. Lots of potential reasons why a horse could be girthy. But what a girthy horse means is when you go to tighten the girth, when you go to ride, they could put their head back, they could put their ears back, they could shake their head, and then you know, okay, there's a problem. So let's just check some of these ulcer points. I talked about them before, but I want to check them again. So I usually check gallbladder 21. And for him, I'm not going to call that positive. I wasn't sure right then. But so then we're going to go into the bladder meridian. We'll go into bladder 13, bladder 12.
He's breathing hard.
Yeah.
When you do that.
Usually chewing isn't necessarily a stress thing, but when they couple it with, if he's a grinder, so if I know that he grinds from stress, then that makes me know that this is a positive point right here. So I'm going to reach down and we're going to see if we find some other positive points. So watch as you guys, okay, so right there, did you guys see that? So right there, he tried to get away from me. I'm barely using any touch here. And he's just like, I don't think so. I'm going to check him to see if there's any chiropractic I can do to help. But so so you guys watch his mouth. His mouth tells you more. And see his ears. Watch the ears, watch the mouth. If he grinds like that, that's not soft chewing. That's stress. That's a sign of stress.
His eyes. Look at his eyes blinking.
And
see
eyes
that?
blinking. No,
like
I don't.
Really fast.
Like ow, ow, ow. Okay, eyes blinking, ears back, grinding the teeth. Okay, let's come into the other ulcer points. See the ears, you guys? See the eyes? So I would say he has some, I definitely definitely think he has some low-grade ulcers, maybe. Maybe they're, ulcers can go, they can be hindgut ulcers, they can be stomach ulcers. So I would wonder about both of those. You guys see that?
That is interesting, his eyes.
He's just like, I don't like that. 2 ulcer points here. He doesn't like that. He's telling me, let's see what happens when I back away. Rockstar, it's not because I'm mean. He's like, is she gonna do something to me? What's she gonna do? All right, let's check the other side. So we'll just check gallbladder. Now he's gonna say, I don't like anything she does. Hey, what about just saying hi? Can we do that? Is that a good idea?
Look how much he blinks. That is so interesting.
It is
I've
a lot
never
of
noticed
blinking. I think it's stress.
that. Oh, baby, he has no reason to have stress.
Just, I think regarding me.
Oh, okay.
Yeah, no, regarding me. I don't think he has stress without me here. He's like, what's she gonna do? Is she gonna give me a shot? What's she? Yeah. But let's just check these points. Okay, this side's, it doesn't feel as bad, but he's still reactive. I'm gonna come back. Nope. So it's really the point right behind the withers. Okay, we're coming down. He's too polite to bite me, I think.
Yeah, no, he's not.
You never know.
He's not mouthy.
Okay, so that's a positive point, you guys. I'm gonna check his sternum just in case, but yeah, because sometimes our sternum is off, but I think he might have ulcers. Come back. And right here is CV12. You guys see the ears? Ears are back. He's breathing faster. Respiration, eyes twitching, ears back. He's not blinding on this side, but who knows? Okay, right now I'm touching CV12. I'm going to come back to CV8 and see what happens. Not too much. So it's all in this general mid-abdominal area. Then we'll check those 2 points back here. And do you guys see that? Do you guys see him tense up around? And all I'm doing is just touching. I'm just touching. And he's tensing around that. So he's definitely, I think, got some ulcers. They're probably minor, but I have to tell you guys, ulcers are super common in horses. They're much more common than we know. Did you guys know that almost every dolphin in captivity is on Tagamet? That is because they all have ulcers. This is dolphins, captive animals that maybe shouldn't be captive. In the horse world, it's kind of more complicated than that because, sometimes it has to do with they don't like their person, sometimes they don't like another horse near them, sometimes they don't like a saddle fit, sometimes they aren't on exactly the right food. So it's quite complicated, but it's also super common, and people, honestly, they'll just girth them up anyway, and they don't even pay attention to it, and then you got a horse that's going to colic. A lot of colic kills a lot of horses. So I don't mean to be Debbie Downer here, but a lot of horses have ulcers, so check your horses. Thanks so much, you guys. Follow, share, comment, subscribe. Now, before I get to the next 2 steps, the last step being the most important, I'll need you to hit that subscribe button. It really helps us out. You can like, comment, share. I know, you're itchy. And tell your friends all about treating ulcers in horses. I upload videos literally every week to help your pet feel better, so you won't want to miss any of them. Preventing ulcers in horses means you have to prevent 2 things. One is stress. I know, you're stressed right now. It's because he wants to roll. Minor stress. But then there's major stress, like if a horse is isolated, he's not with his friends, he's in a position where he's worked, he's in a stall all the time, and you pull him out and you work him really hard. Horses like to walk, horses like to trot. They don't necessarily like to work really hard, at least not without being out all the time. So horses love to be outside. That's where they should be. And when they're inside and when they're in a very confined situation, that's where we see a lot of ulcers. And did you know that 70%, up to 70% of performance horses are believed to have ulcers, and up to 90% of racehorses. And a lot of that is the management. So right now you can see some minor ways he's showing stress by chewing and throwing his head around and things like that. And all that is because he wants to roll. So it's not the same as long-term stretch. This is situational stress. But the other cause for ulcers is pain. And a lot of horses are in pain. There's really not a way that they can show their pain, but they could be in orthopedic pain. They could have, they could have myofascial pain. It's really common now to have immune-mediated myofascial pain. All kinds of pain. So pain, low-level pain, is a really common cause of ulcers. So I want you, when we talk about treatment, I want you to, in your back of your mind, think, I shouldn't have to treat ulcers because I don't have them in the first place, because my management's so good. Horses need fresh water all the time. Ideally, horses have hay in front of them all the time, or some type of roughage all the time. So we're not giving them a high sugar, high calorie, just a couple times a day food. We're giving them all the time, low calorie, high roughage type food. So how you feed them, how you stall them or don't stall them. I'm not saying stalls are bad, it's just that every day they need to get out. Like this, mix out, and then you see, we don't have any ulcer points with him. So the next step is the last step, and go ahead and stop. But you can't stop there, because the most important part of ulcer management comes next. The last thing I want to talk about is how to treat current ulcers. So say your horse has old active ulcer points and you're like, what do I do now? What do I do now that's natural? I mentioned also already about trying to get your horse outside, trying to get your horse moving, just slowly moving, trying to get your horse eating all the time. How often can he eat? A little bit of roughage is a great thing. So all those are good things. But the other thing is I'm going to talk about herbs. So marshmallow is my very favorite anti-ulcer herb. Hold on a second. I've got a horse eating a halter. All right, come here, little baby. Come here, baby. Good boy. Come on, Mickey. Come on here. Good boy. Look at you. Yeah. You can play with your halter. Here. Good boy. Okay, you guys, marshmallow root. Marshmallow root is what we call a demulcent. So what it does is it lubricates and soothes and heals the intestinal lining. And it does that through being a demulcent. So does slippery elm, but they're different. Slippery elm is not as ecologically healthy. There's a lot of issues around the elm family, whereas marshmallow doesn't have those issues. So as you'll find that marshmallow tends to be cheaper than slippery elm, and that's mainly because of these ecological issues. Both of them are demulcents. Another demulcent that has a lot of benefit with ulcers is licorice root, but I don't recommend licorice root in any horse that you think could have Cushing's disease, because it's contraindicated. So a lot of people are deglycerizing the licorice, and that helps to prevent hyperadrenal corticism or Cushing's disease. Come, you're a good boy. So I'm gonna go ahead and touch him. Yeah, you're a little bit of he hasn't been worked in a long time due to the weather, so that's not helpful. Okay, let's hope. Good boy. So we've talked about demulcents and how they heal ulcers. My very favorite thing that nobody seems to be doing and nobody seems to be recommending, but I think it's super helpful, is valarian root. Valarian root is an excellent anti-ulcer because it relaxes spasms. It heals the ulcer, not by being a demulcent, but by relaxing the nervous system and musculature. So it's actually helping the ulcer by relaxing the horse, which you can imagine is really helpful since stress is a big part of ulcers. So we've got marshmallow, we've got slippery elm, we've got valarian, and I'll put the doses in the description, but basically it's going to be 5,000 milligrams of slippery elm, 5,000 milligrams of marshmallow, And then just a human dose of valerian is fine. It's a stronger herb, so we just need a small little bit of it. Just wait. I don't use aloe vera because it's very cold. And in some cases that's great, like a young horse. And in other horses, aloe vera, it's just not as helpful. So I use these other herbs instead. The last thing we like to do, well, the two other things. One is B vitamins. Want to make sure you're doing a multi for your horses, something that's balanced with B vitamins. And the other thing is calcium and magnesium, especially magnesium. Magnesium is an excellent preventer for ulcers and also treatment for ones that are there. 2,500 milligrams of magnesium. Hey, just wait, back up. Oh, yes, I know. And 5,000 milligrams of calcium every day. So Platinum Performance has that. All kinds of different, I'll put the different suppliers in the description. For the herbs, you can get the powdered herbs in bulk from Mountain Rose Herbs. And that's the best way to do it. Just remember, you have to order them in powder. Let's just let him do his thing. So let's see. We talked about how to diagnose ulcers, we talked about how to prevent ulcers, and we talked about how to treat the ulcers that are there. So how long should you have to treat the ulcers before they go away? Usually 6 to 8 weeks, and then that ulcer will be gone. Guys, I'd rather have you guys not depend on omeprazole or any pharmaceutical intervention, because that's the ultimate crutch. What happens is the body gets completely dependent on it, and it's really hard to get off those things. Even the herbs can be a crutch. I don't like people just giving their horses ulcer prevention herbs, because I'd rather have them working with the prevention, the maintenance prevention, the lifestyle prevention. Mick and I say subscribe, share, follow, comment. Let me know how your horses are doing on my recommendations for ulcers, diagnosis, prevention, and treatment. If you love this video, you're gonna love this one, which teaches you positive ways to train your horse. Remember, positive training and excellent interaction with your horse is another way to prevent ulcers.